Hey, this is a Hakawati production.
Before we start, if the sound quality is kind of iffy today, that's because we couldn't get to the studio again this week due to COVID lockdowns. COVID vaccines are being rolled out around the world, but how optimistic should we be? Is this the silver bullet we've all been waiting for? What do we really know about these vaccines that have been developed at warp speed? And what are the differences between these different formulas? My guest today is here to help us sift through all the information and the latest headlines. She's the head of the Division of Infectious Diseases at the American University of Beirut Medical Center. She's also the chair of the Infection Control and Prevention Program and a consultant professor at Duke University in North Carolina. Please welcome to the show, Dr. Souha Kanj. Dr. Kanj, welcome.
Thank you, Nadia. Thank you for having me.
It's great to be speaking with you again. I interviewed you for an article I wrote in the beginning of the pandemic. I don't know if you remember, and we didn't really know what was going on, but that was almost a year ago. And here we are again. Will this ever end?
Yeah, I remember very well. And as you stated, it was at a time we could not predict for how long the pandemic will go. And here we are a year later, still in the midst of it. And actually, I would say in the peak of it in Lebanon.
Yeah. And I know that Lebanon, where you're based, is scheduled to be receiving its first shipment of vaccines right about now or this week. Have you had it yet? Are you planning on having it?
So Lebanon, we are planning to have it. The first shipment, I believe, will arrive on February 17.
So you haven't had it yet?
Yeah. So I developed COVID and I have immunity. So I don't belong to the category of high priority, although healthcare providers are classified as the highest priority together with the citizens who are 75 years of age or older. But people who have acquired the COVID infection and are expected to have antibodies, therefore immunity to last for several months, would not be considered in the first priority. So personally, I've not had it. Nor my family.
That's so interesting because as a infectious disease specialist working in this field and dealing with this, I would have expected that you would have been so cautious and careful. Can I ask how you got it?
So I'm usually very cautious. And as you can imagine, as an infectious disease specialist, and particularly as the one in charge of the infection control and prevention program, we put the guidance for staff for what to do to avoid infection. Actually, I remember vividly how I got it. It was at a time when we started to see a peak, and we had put regulations that all the patients who come to clinic have to be screened for the presence of fever or cough before they enter the clinic. And if they satisfy a certain, a questionnaire that says that, yes, I do have one of the manifestations that possibly could be related to COVID, they're supposed to go to the COVID clinic to get the PCR test before they're seen in our clinic. So in that particular scenario, and I know the patient who I acquired it from does not know the story yet, but I plan to tell it to him one day. He came to my clinic, and when I started interviewing him, he said that he had been coughing. And then I said, well, how come you're in my clinic and you have a history of cough? You should have gone to the COVID clinic to be tested. He said, no, I've not been leaving the house. We don't see anyone, just my spouse and myself. We're locked down, etc. And that's why I told the nurse that my symptoms are not related to COVID. So I went in the room wearing my mask. He was wearing his mask. I examined him in the small cubicle room. And then as I was examining him, he removed his mask and coughed 3 times, very strong cough. Now, immediately, I urged him to put the mask back. And I said, even if you don't think you have COVID, you really need to put the mask back and you have to go immediately to be screened. And so therefore, all along, I suspected that COVID could be a possibility. 24 hours later, I received the news that he had COVID. And then, within 24 hours extra, I started to feel malaise and fatigue. And this is when I knew that I had it.
Well, I'm really glad you're okay. But let's talk about the different types of vaccines that are available now on the market and being distributed around the world. Can you give us just a quick rundown of what's currently being distributed around the Middle East specifically?
Right. So there are the first one that was released in the Middle East in the United Arab Emirates, UAE, was the Sinopharm vaccine. Which is the Chinese vaccine. It's an inactivated virus vaccine, and it's typically administered in 2 doses with 3 weeks in between. And this vaccine, supposedly, depending on the clinical trials, is projecting that it has quite a high efficacy, but we still don't know the accurate numbers, whether it's 70% or 80% or more. The ones that were used in other places are the mRNA vaccine, the Pfizer-BioNTech vaccine. So the messenger RNA vaccine is a new technology. You have the messenger RNA with nanoparticle, and this is a whole new technology for vaccines. It is supposed to give prevention in 95%. Of the people who receive it. And it is also administered in 2 doses, 3 weeks apart. The other mRNA vaccine that's also available now on the market, mostly in the US, is the Moderna vaccine. This is also a vaccine that promises to have a high efficacy, 94% in preventing symptomatic infection. And the time between the 2 doses is 28 days. The other vaccines that seem to be quite promising, and I think today we heard that Janssen, part of Johnson & Johnson, will be filing to have approval for the FDA for vaccine. And the good advantage of this vaccine is that it's in a single dose, and it's cheaper than the others. And unlike the mRNA vaccines, does not require the special refrigeration, because the Pfizer vaccine has to be at a minus 70 degrees to keep the nanoparticle and the mRNA stable. Whereas the Johnson & Johnson vaccines are made through the traditional ways, and it's a single dose and don't require any particular conditions to preserve. The other promising vaccine is the AstraZeneca, or the other name for it is the University of Oxford, because this is where the research was done. It's an adenovirus-based vaccine. And the numbers we've heard in terms of efficacy in preventing disease is 70% in preventing severe disease and hospitalization. It's also a 2-dose vaccine, and they need to be taken 4 weeks apart. Now, last week as well, there was a study published in one of the very prestigious journals, The Lancet, on the Russian vaccine. This is the Sputnik vaccine. It's also a recombinant adenovirus based vaccine. And the studies indicate that the prevention of symptomatic disease was 91% and 100% prevention of severe disease. It's also a vaccine that requires 2 doses to be taken 3 weeks apart. And then the last one, the one that we've heard about also, is Novavax vaccine, which is a protein subunit vaccine. And I believe it's available in some of the Arab countries, but I'm not sure which ones yet. Also, it promises to have an efficacy of 95%. against the original novel coronavirus, and perhaps 85% efficacy against the UK variant, the one we've heard about, the B117 novel variant.
Yeah. So, what about this new variant and these other vaccines? Are there concerns that they're not as effective against this variant? It must be difficult to measure the efficacy.
Yeah, so there are concerns about the UK variant, but there are even more concerns about the South African and the Brazilian variants. And I think it's a bit too early to say which vaccine will have more efficacy against those new variants, the South African and Brazil in particular, because they were only described recently and we need more time to learn about efficacy against the new variants. I know that there are pharmaceutical companies who have already started to speak about work on a polyvalent vaccine so that it will be efficacious against all the circulating variants. I think we'll need more time to learn what's true about this.
So, are there shortages of any of these? And is there more of a supply, for example, of the Chinese vaccine? You hear people talking about, well, if these other ones aren't, we'll take this less effective Chinese vaccine. And are there any fake vaccines going around?
Let me answer the second question first. So I've not heard about fake vaccines yet. I won't be surprised since there are fake medications everywhere. But at least we have not heard anything publicly yet. In terms of shortages, yes, obviously, if the plan is to vaccinate the whole universe, you can imagine that the number of vaccines needed is humongous. And despite the fact that a lot of pharmaceutical companies have really directed their efforts to vaccines and stopped manufacturing some other medications recently, so that all the manpower and machine power will be directed towards the vaccine, the required number is humongous. So obviously there will be a shortage, but the fact that the whole universe is not depending on a single vaccine or a single company to make that vaccine makes it a lot easier. And that's why I think the advice we've been telling people is the first vaccine you can get your hands on, go ahead and take it, even if the efficacy is not 100%. Actually, in medicine, there's nothing that's 100%. None of the vaccines that we've used historically in the past had been 100%. So the vaccines can prevent a certain percentages of infections. So with all the vaccines that I mentioned, all of them seem to give results at least 70% or more. And so therefore, we're telling people, the first vaccine you can have your hands on, go ahead and take it. Now, obviously, the ones that require 2 doses become a little more difficult to take. But as I mentioned, the only one that seems to require a single dose right now is the Janssen by Johnson & Johnson. And we're waiting to see if FDA is going to approve that based on the studies provided to FDA, which we've not seen yet. All we've seen is press release saying that this is a great vaccine, a single dose, cheaper than the others, and very efficacious. So we need to see the data to judge.
I think what people are most concerned about, though, is the unknown long-term side effects. Do you think that there could be long-term side effects based on your experience studying other vaccines, learning about the components of these vaccines?
So let me first mention that I think for people listening, the common side effects that we see with the vaccines in general are typically very mild. And they are like any other vaccines. They can be pain and redness at the site of injection, little fever, little fatigue, muscle pain, headaches, some chilliness, some joint pain. Some people have experienced just feeling unwell for a few days, some nausea, and some people have swollen lymph nodes. Now, in my mind, when you get some side effects to the vaccine, it's a good sign because it means the vaccine is working and it's stimulating your immune system to form antibodies. If you get a vaccine and you have absolutely nothing, to me, it means your immune system is a bit lazy and not reacting to what you want it to do. Now, obviously, with the mRNA vaccine, we've heard that people have had some severe allergic reaction. And then, therefore, if you are getting the mRNA vaccine and you've had history of major allergic reactions in the past to certain drugs, any medications, antibiotics, or other vaccines, these patients, if they have the choice between the mRNA vaccine and another one, then maybe it's more prudent to go to the other types of vaccine, because there has been reports of severe allergic reaction. For any vaccine, I usually recommend for people to be monitored for 15 minutes to make sure that they don't develop a severe allergic reaction that would require intervention. Now, if the patient has a history of severe allergic reaction to something else, then maybe this monitoring needs to be a bit longer for 30 minutes. The long-term side effects of any of the COVID vaccines, I think, is unknown. I think if someone stands up and starts speaking of the long-term safety of the COVID vaccine, I don't think that's honest. This is a vaccine that we've had for less than a year. So how can you speak scientifically about long-term side effect of something that you've only had for 1 year? So I think it's very premature to speak about long-term side effects based on what we're hearing and the technology and with the virologists and the scientists who worked on these vaccines. They're saying these seem to be safe with no long-term sequelae. My personal opinion is to say we don't know yet, but from our experience with other vaccines, I'm not aware of any other vaccines that caused significant long-term sequelae that were of concerns. Now, there's a lot of talk about the potential risk of infertility with the mRNA vaccines. I would say we don't know. We really don't know. We don't know if COVID can cause some degree of less fertility in the immediate post-infection course. We don't know. I think the best way to answer this is to say we don't know yet.
Yeah, I remember reading about possible effects on men's fertility with COVID, with the virus. So it'd be interesting to see. And when you say about the vaccine, would that be for both men and women, for just men or women?
I really would say we don't know. We don't know. The scientists are telling us, no, it doesn't happen because the molecular mimicry between the proteins on the sperm and the eggs and the mRNA triggered protein seem to be a far-fetched possibility, but we really don't know.
Okay. So we're all kind of gambling with the vaccine, with the virus. Nobody really knows. That's why people, I think, are so worried right now, because there are so many unknowns.
Yeah, but I would say we are in a state of pandemic. We cannot wait to have a herd immunity to get out of this pandemic. The only way we're going to get to herd immunity is with the vaccine. If we wait until 70, 80% of the population is infected, we're going to be losing a lot of lives. And although at the beginning of the pandemic, we were saying that only older people and people with cancer and other major medical problems are dying, and the mortality is less than 1% in total. But as we are seeing more and more patients, we're learning that the mortality in the older age group is, 12 to 15%, but also we're seeing mortality in patients who are not old, who are not cancer patients, who don't have what we call comorbid conditions. So, we're being traumatized with losing young patients who were previously very, very healthy to COVID infection. And so I think if we keep that in mind, we come to the conclusion that herd immunity, which will take a long time to occur, is not the answer if we want to wait for the natural infection to allow to reach herd immunity. I think, therefore, the vaccine becomes the natural choice.
So at what point do you think we'll see a turning point when the risk of exposure will be exponentially reduced, both by herd immunity and high rates of vaccination? When can we stop worrying about this so much? Because at the end of the day, the whole world is connected. So all the different regions are having kind of a different timeline. We know Israel is kind of ahead of the curve. The UAE in the Middle East is in second place with the most vaccinations. Yeah. Lebanon is getting it now. But a lot of the poorer countries will probably be the last to get the vaccines. At what point do you foresee that we can put this behind us and live normally again?
Yeah, I think you pointed out very correctly to where the problem lies, is the fact that we're very connected. And also, as you mentioned, even within the Arab countries, we have so much discrepancy between the policies on vaccination and availability from one country to the other. So, for example, I can't imagine that we're going to have a vaccination available to Yemeni citizens very soon, nor to Syrian citizens very soon, because of the financial and political difficulties we're all aware of. Whereas UAE is not only offering vaccination to their citizens, but also to people who have who work there from other nationalities. So I think, you pointed out to our neighbor to the south, and today they reported that they've already seen 30% drop in their number of new infections per day, and I think 35% less case fatality rate already, because they were very aggressive with the vaccination. So I think it's hard to predict, but what's good now is that there's a lot going on to try to provide poor countries with the vaccine, because as you mentioned, in order to control the pandemic globally, we need to think of all the countries and not just the countries that can afford to pay for the vaccine. I think it's hard to predict when this will end, but somehow, if all things go right, I feel by the summer we're going to be okay. This is just a prediction and not based on any accurate mathematical model, but just from talking to colleagues at WHO and other experts in the field from Europe and the US. They seem to think that by the summer we're going to have things under control.
Well, that would be fantastic. And I think everyone is just looking forward to that light at the end of the tunnel. But obviously, the vaccine is the ultimate solution to the problem, but it seems like it'll be a while before everyone gets it. In the meantime, many doctors around the world are talking about prevention. For example, one doctor in California, Dr. Mark Gordon, his name is, he's an expert in the field of neuroregenerative medicine. He recommends supplements and dosing to kind of bulletproof yourself against COVID if you haven't had the vaccines. And he suggests supplements including zinc, quercetin, vitamin D, and DHEA, all in very specific doses. And he's done, studies on this. And he talks about also turmeric because it's an antioxidant. And he explains how it protects the cells against the viral infection in a very specific manner. Does this make sense to you? And is this something that you guys talk about in the scientific community and the academic scientific community who are studying the vaccines and the disease?
First, the field of neurodegenerative disease is a well-known field, and it studies the diseases that affect the brain and leads to early dementia, basically. So it's a field from neuroscience, and it's a well-recognized field. I'm not familiar with Dr. Gordon. Let me tell you how we feel about these things. Well, first, the best way to prevent the virus is to wear a mask. Because now, again and again, all the studies are showing that you acquire the virus by inhaling the virus. It goes through the nostrils, goes down to the lungs, and therefore, all that was said about the surfaces and cleaning the surfaces, etc., maybe it's not a bad idea to practice clean hands and clean surfaces all the time, but the most important is not to inhale the virus. So I think the best way to prevent remains to wear a mask. And even for people who have taken the vaccine, they should continue to wear a mask, because as I gave you the numbers, none of the vaccines is 100% efficacious. So therefore, mask, 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 until the pandemic is over. That's the first thing. Now, the second is all the supplements that people are talking about, the vitamin C, the vitamin D, the zinc, the melatonin. What we tell people is that, try them. They don't hurt. They might help. The scientific evidence behind them is not very rigorous. For example, there are studies that have shown that low vitamin D correlates with higher mortality or higher acuity of the infection and more complications. But there are no studies that show that if you take vitamin D, you improve the outcome of the patient. So people are inferring from some studies to say more than what the study says. But my motto has been since the beginning of the COVID pandemic, and you can imagine how many calls we get on this, is that if things don't harm and might help boosting your immune system, making you feel better, or even a placebo effect, go ahead and take them. I wouldn't go to what some people are doing, taking mega doses of these vitamins and zinc, and because this can have side effects. But a single vitamin C per day, vitamin D, 2-3 times per week, zinc 25 milligrams per day is fine. Turmeric is a very well-known anti-inflammatory powder, and if you use it with black pepper, it does reduce the inflammation. Yes, and I tell this to my patients with autoimmune diseases: add turmeric to your food. But does this prevent COVID infection? I don't know. The studies have not been done in a rigorous way to answer the question.
I have a question about that. Do you think it's possible that prevention is underrated in the research community, and that they don't put as many resources towards studying the potential benefits of specific doses of these supplements? Because if you found that it worked, then you wouldn't have a reason to produce a vaccine that makes millions and millions of dollars for these companies who are sponsoring these research studies. Is this possible? And what are you thinking?
Well, I mean, yeah, obviously we live in a world where money and profit is the name of the game. So obviously that is in the equation when people think about designing new drugs or new vaccines. I think the answer to your question is physicians who are interested in what we call alternative medicines or a natural way of healing, they can come up with rigorous research. It has to be, randomized, controlled clinical trials that look at two groups of people, controlled for all the variables, give one group the vitamin or whichever type of powder or curcumin or whatever you want to study, and do it in a controlled manner. You give a group that product, you give the other group a placebo and test it. I think there are other examples in medicine where people have looked at studies for other conditions. Once it's done in a randomized, controlled manner, then even physicians and scientists pay attention to these studies. And I'm not saying that we're not interested to look at such results, but what I'm saying is the studies have not been done in a rigorous way to answer the questions yet. You're going to see a lot coming out on ivermectin as prevention, because you probably have heard that this is a drug that is typically used to treat parasitic infection. And a lot of investigators have been interested to look at it for treatment. And I think soon we will see a meta-analysis published on all the studies that have looked at whether ivermectin is efficacious or not in reducing the severity of COVID-19 infections. But there are studies that have looked at it as prevention. And I'm getting calls all the time now. Should we take prevention ivermectin every 2 weeks, a single dose? And my answer is, let me wait until I see the published studies, which are not out yet. Once we look at the studies, if they are conducted in a rigorous way and the results are convincing, then why not? This is a cheap drug. Maybe it's very efficacious. We need to look at the studies and judge.
That's interesting, because wasn't one of the first supposed cures also an anti-parasitic drug that people were using to reduce the symptoms?
Yeah, that's it. That's the anti-parasitic drug.
It's the same one. Interesting.
It's the same one. Yeah.
Okay. So I think there's a sense of suspicion in the world that this virus may have been intentionally created to disrupt the status quo. So it's kind of a conspiracy theory, but a lot of people think it's possible. Don't put anything, above. It's possible to control overpopulation. Some people are saying that this was released into the world for that purpose. But there's also been talk about microchips being in the vaccine. Is that technically possible?
I wouldn't know how to answer this. There's a lot of circulating news about such things and conspiracy theories. I'm not a person who usually dismisses such things without looking at the evidence. I think at this point, WHO is investigating the origin of the virus, and they send a whole team to China to try to understand how it started, how it spread that quickly. It spread very quickly globally. There are a lot of unanswered questions with this virus. I prefer to say we're waiting to get the full story. Obviously, there are unanswered questions, and this is a virus that's teaching us a new lesson every day. Some things that we predict today are not happening tomorrow, and the rapidity with which the new variants are developing in various places, etc. A lot of unanswered questions. We're all eager, to really wait for all this to be answered. I think that would be the most appropriate way to answer that question.
Yeah. Is it technically possible, though, to put microchips in a vaccine, you think?
Well, it's not microchips. I think they're worried that the nanoparticles, can be the chips that therefore can allow people to follow where you are moving, etc., etc. I don't know. I'm not an engineer, and it's hard to imagine that will be the case. I don't know. I would say I'm not convinced that that's the case right now, but I think we need time to unravel a lot of these uncertainties.
Okay, we'll find out soon if people are being tracked. Hopefully, or probably not. But Denmark has announced that its citizens will now have a vaccine passport. And Sweden is following suit. This is happening as we speak. And some countries like Greece are saying if that's the case, they'll forego of quarantine time for people coming in who've had the vaccine and who can show it with these kinds of passports. As a specialist in infectious diseases, do you think that airlines should require these passports and proof that they've been vaccinated? Should this be a new criteria for being allowed to travel? As a doctor?
Yeah, well, first of all, I'm all against forcing a vaccine on someone who is not convinced to have a vaccine. I think I've told people the vaccine should be a personal choice. You can go to your doctor, they can tell you what are the benefits of the vaccine. At the end of the day, it's a personal choice. And this is not the first vaccine that people might refuse to take. There are many other vaccines that people have just not taken. In a recent survey in the US, yesterday there was news released that 24% of a large number surveyed, they said they're still not ready to take the vaccine. So vaccination is a personal choice. I think one should educate the people about the benefits, recommend it. But if at the end of the day they say, I don't want to take it, I don't think we should force a vaccine on anyone. And from that perspective, I don't think airlines should require to have a certificate for a vaccine. Besides, if someone has immunity to the virus and they decide they don't want to take the vaccine right now because they've developed immunity to the virus, you can't force them to take a vaccine, because historically there are no vaccines that have created more immunity than the virus itself for other diseases. So I think they're taking it too far by obliging people to do it. On the other hand, Switzerland has decided to not even talk about vaccine for 2 months until they see what happens in the rest of the world with the vaccine. So I think these are individual decisions by countries taken at the national level based on maybe advisors, to the ministers of health in those countries, etc. I don't like extremes in life nor in medicine. I think we should encourage people, recommend it, talk about the benefits, the personal benefits as well as the benefits to society. But I wouldn't go all the way to force people to do it if they don't want to.
That makes sense, because at the end of the day, it's a personal choice to get on a plane, to travel. And so to force people to have a vaccine doesn't seem, it seems like a violation of personal choice. So yeah, that makes sense. And if you're going to fly, you're taking a risk anyways for many other things. So it's a good point. Dr. Kanj, thank you so much for taking the time to do this. I know it's an extremely busy time for you. Is it the most intense in your entire career?
Yes, I think it's the most intense, and I was waiting until my kids grow up and until I become a full professor to start, slowing down. I became tenured professor 3 years ago, and I thought it's now about the right time to start slowing down and, concentrate more on mentoring young people and working less clinically and less legwork. And then the pandemic started. So I would say, I was talking yesterday to my husband and my daughter, telling them I feel like I'm working as much as 3 doctors at the same time. So it's been really intense, nonstop for a full year. But at the same time, these are the most challenging times. And, maybe 10 years from now, we'll look back and say, we were lucky to experience the challenges that face humanity, and feel that we're in the medical profession, which is at this point the most valuable to help humanity, I think. So I think, yes, very challenging times, working very hard, but we're blessed that we're in a profession that every night we say we're able to help people.
Well, we're so grateful for what you're doing. Thank you so much. And thanks so much for explaining everything in such an eloquent manner today.
Thank you, Nadia, and thank you for having me.
That's all for today. I know it was a lot of information. Thank you for joining us. If you enjoyed the podcast today, be sure to subscribe to the show, and we'd love to have your comments. Stay healthy and take care.